I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Roll call, Doreen.
Amo,
Here.
Anagnostakis,
Present.
Lujan, Sutherland,
Here.
Bartel,
Here.
Shuey,
Here.
O'Donnell,
Here.
6 present, 1, 2, 3. Wait, I'm sorry, 7 present, 1 absent.
All right, thank you. I just want to start off with thanking all the legislators who attended the Valley View Family Council meeting last week. We got sent 6 questions from them that I'm going to answer by the end of the week, but we might have some members of the Family Council listening in today. So they requested a list of the capital improvements for 2021. So there's 11 items in the capital budget for Valley View this year, totaling $2 million and $40,000. And I won't list them all, but I will send to every legislator a copy of the email I'm going to send to the Family Council. They also requested some information on Wi-Fi, and we got a message from the Director of Client Services for Orange County, and I'll just read the email. A new wireless network, SSID, has been set up for the residences of Valley View, allowing easy one-time setup on their personally owned communication phones, tablets, devices by Valley View staff. Lori over at Valley View has been installing the new network access on patient personally owned devices with success, and this allows for easier use of applications like FaceTime for communication to family members. Also, Mr. Burpo has been in contact, I think, with Verizon to expand the Wi-Fi capabilities out there. So a lot of good things on our end are happening out there, and I'm looking forward to Commissioner Ledoux's report later in this meeting. But for now, we'll go to item number 1, the Commissioner of Mental Health, Darcy Miller's update. Commissioner?
Good afternoon, Chairman O'Donnell. How are you?
Good, thank you.
Good. I love being first on the agenda, so I'll move fast for you.
My birthday's coming up, just so you know.
Oh well, I'll make sure. It's probably already in my calendar.
We'll see what list the number you are next month, Darcy.
I'll send you a cupcake.
Oh, perfect. It's Mrs. O'Donnell's birthday today, so I'm being nice to everybody. All right.
Well, happy birthday to Mrs. O'Donnell.
Yeah.
So let me tell you the project Hope that we've been talking about at every meeting, that the federally funded program with Access Supports for Living, Mental Health Association, Independent Living. They're all contracted with the state. It's about $1.4 million. We'll bring a plethora of staff into our community. We expect to see them marketing any day now and providing services, mostly, of course, virtually at this point, but we'll be doing some as available. Sorry, I'm echoing. Doing face-to-face as needed. The executive orders for telehealth have been expanded. They've been doing those every 30 days. The governor has committed to having expanded telehealth beyond the pandemic, which you'll see from the numbers that came in. We produced, I think, 1,400 more units of service last year than we did the year before. Some people really like telehealth. All of our staff, client-facing staff are eligible for vaccinations in 1A. All of mental hygiene staff, so substance abuse, mental health, and/or developmental disabilities who are client-facing, became eligible in 1B. Unfortunately, the struggles everyone's having getting vaccinated are there. And in the meantime, they will continue with primarily virtual work. But we are looking forward to getting more face-to-face back in place. The 20% withholds continue into Q1 of 2021. remains to be seen what happens under the new federal administration. I sent on a separate email, social media messaging that was created by one of our staff here. We really appreciate the work she put into that. But that is in response to the increase in substance use that's happening as a result of the COVID pandemic. We really would be hopeful if you have social media outlets, if you would share those messages, share them with anyone who's been, part of your social media following, to put them out. It's really talking about the risks of increased alcohol use, which we've seen is very prevalent during this experience. There were 6 overdoses in December of alcohol alone. They didn't result in a fatality, but the alcohol abuse has become very serious over the last few months. Additionally, the opioid fatalities have increased. Our OD MAP numbers show 165 fatal losses in 2019. Still waiting to get confirmation from a medical examiner's office once they're able to complete all of those evaluations. But many losses, and we appreciate everyone being a part of the solution, getting prevention messaging out. And that's all. Jimmy, you're muted.
Okay, thanks. What age group was the alcohol?
Oh, I can get that. I don't have the demographic off the top of my head, but I can get that off of the information we have, and I'll let you know.
Yeah, thank you. I'd just be interested to see if any of them were school age.
I think it's people who are birthdays.
Yeah, well, I don't
I'm
think
just kidding. I'm
I
not trying
gave
to
up the
make light of it.
days
It's
of
very serious.
over imbibing. You should have seen me when I was younger, so.
And the score is 1 for the commissioner, 0 for the chairman.
Yeah, exactly.
Yeah.
Doreen, make sure she's at the end of next month's meeting, please.
I'll relay that message to Jean.
All right, just get us that information, please.
Will do.
Darcy,
All right.
because it would be interesting to see if any of those 6 on the overdoses were school age. So.
Yeah, and I can give you the demographics for all of the overdoses. You can see where the highest prevalence is as well.
Okay, thank you.
Thank you. Take good care.
Any questions for the commissioner? I don't see any, Darcy, so thank you. Have a good night. Next up is Leader Amo, who has a resolution requesting the New York State Commissioner of Health to adjust the Medicaid transportation reimbursement fee schedule for Orange County. Do I have a motion?
Tortel, so moved.
And seconded?
Tortel,
Legislator Tortel, you did the first one, so we'll have Pete
Tui.
Tui
Sutherland.
seconded. All right, thank you. Leader Amo, the floor is yours.
Thank you. Thank you, Mr. Chairman. This is a redo, a mulligan, as I think they say in some games. In 2019, we did a similar resolution to the state for the very same reason and got no action. Absent of the fact of believing you do the same thing multiple times and expect different outcomes is insanity. We should try again. I think we should try because the numbers are just that really ridiculous. We know that the pickup rate is like $6 more for contiguous counties than we get in Orange County to pick up a Medicaid patient, medical patient, and take them to the hospital and do doctor's appointment. The gas mileage is off by 64 cents per mile. So we know that we're not getting our share. And the biggest problem, in addition to really hurting the medical needs of our residents of the county, is that it's also hurting the businesses that want to do transportation, the taxi companies, the livery companies. They're going to find themselves going out of business. They cannot compete at this level, and they're going to stop doing medical transportation or go out of business. So in the long run, we're really going to be hurt. So I think it's imperative that we send this back up to the state and ask them to consider it in this budget, although it's not very likely given the problem with the budget, but we should give it a try. I think we also should reach out to our senators and assemblymen that represent us, Mr. Brabenec and Gunther, have really been supportive. And the last time we tried it, I'm sure they will be again. But we need to put pressure on people to help see if this can move forward as a budget item to put more money into this project. Historically, Darcy said it last time and has told me a number of years ago, maybe 10 years ago, how we got here is 10 years ago, the county was in charge of medical transportation. So as a result, we can argue our point, work on trying to make things equitable and work it out at our level with the state. A number of years ago, the state decided they wanted to take it all over. So when they took it over, we're totally out of it. We have no say in it. So what we're seeing here is just we're at the mercy of the state of New York to give us a fair reimbursement for our medical transportation. So we had this passed the Human Services Committee unanimously. I hope we do it here. And last time in 2019, we set it up. We had 21 legislators sponsoring it. So I hope we can get some unanimous support here. Thank you, Mr. Chairman.
Muted, Jim. Jim, you're muted. 2 strikes. Any questions for Leader Amo? Hearing none, all in favor?
Aye.
Aye.
Carried unanimously. All right, same as in Human Services previous to this. All right, next up is Commissioner of Health Gelman and Deputy Commissioners Erickson and Ventry for monthly update from the Health Department.
They're here.
I see Chris.
Yep, seeing if Dr. Gelman is on. I know she said she was on, so let me just double
It says
check on
she's
that.
muted. I'm sure she's muted.
Hold on 1 second.
Okay, it doesn't look like she's muted now. Is she there?
All right, we'll come back to you, Chris. We'll go to item 4, Valley View. Commissioner Ledoux, give us the monthly finances. We can see you. You don't have to get up and run. There you go. All right.
Hi, good afternoon, everyone. It's Donna. This is the December financials. This is at 1/12/21. Lots of year-end activities going on right now. So this does not represent the final outcomes for the facility. County taxation remains 0. IGT funding, it moved up from the last publication. We received a little over $3 million. Still expecting one payment before we close out the year. Appropriated surplus, no change since the last publication. Emergency disaster, that's the money received under the CARES Act, coming in at $2,457,000. Other revenues coming in at $38,379,000. We have an additional $3 million that hasn't been posted there for December activities. On the personal service side, we're at $22.8 million. Equipment, $203,000. On the contractual side, we have $1.8 million that we have in expense that's been encumbered. We have $11.7 million that we've expensed through December. Employee benefits are coming in at $16.6 million, and a small amount of serial bond interest at $146,000.
Any questions on financials? I don't see any. Thank you. Commissioner Ledoux, the monthly update.
Sure, I sent this out. I hope everybody had a chance to read it. I'll just update it with today's information. So our census today is 258, which equates to 72%. We did start taking in new admissions again last week, which is good. We obviously need to do that. We have 6 COVID positive residents in house currently. We have 15 staff out at the present time that have either tested positive or out of work because they were exposed to a COVID positive person outside of work. We had 2, Valley View had 2 COVID vaccine clinic dates on January 4th and January 8th. In total, 211 residents and 120 staff received their first COVID vaccine dose. 47 residents were unable to get the vaccine due to declining it, either having a recent COVID positive test or they had a fever or they couldn't take it on the day of administration. Our next COVID clinic dates will be on January 25th and 27th. Staff and residents will receive second dose and first doses on these dates. And then February 15th is the last scheduled COVID vaccine clinic for the second doses for those that received the first dose on the 25th and 27th. We are testing staff twice weekly now per the New York State Department of Health. Family in-person visitation is still prohibited at this time. Residents are communicating with their family members via window visits, phone calls, and FaceTime calls. We did receive $659,916 from a 1% Medicaid supplement that was due to Valley View. That's not reflected in the financials, right, Tom?
No.
It's not reflected in these financials. It'll be reflected in next month's financials. And as Donna mentioned earlier, we did receive an IGD payment of over $3 million.
All right. So 47 residents did not get tested yet, and you said 2 of those 47 declined?
I don't have the total number of declines broken out here, but 47 residents total didn't get the vaccine on the first 2 dates for either one of those 3 reasons. They were COVID positive, or they had a fever, or was contraindicated at the time of the first clinic dates.
Okay, and the staff, 126 out of how many?
120, we have approximately 358 full-time staff. We probably have over 400 staff in total if you count the per diems and the part-timers. Unfortunately, the staff have not been as eager to take it as I would like them to have been. So I'm hoping they take advantage of our next clinics on the 25th and the 27th.
All right, so we can't force them to take it, obviously. And the new admissions, what's the protocols on that?
So they have to have a negative COVID test within 48 hours of admission at the hospital. And then they are quarantined for 14 days upon admission, just as a precaution.
Okay, and the county exec just texted me. He's on the call, so if anybody's got any questions for him, now would be the time to ask him. So, in the meantime, Leader Amo has a question.
Yeah, Lawrence, just straighten me out here. I heard when the chairman asked you, you said we cannot require staff to receive the vaccination.
No, it's completely voluntary. It's an emergency. Maybe Dr. Gelman can give you more specifics on this, but I believe because it was an emergency approval, they could not mandate healthcare workers to get it. So it's a voluntary program to get the vaccine.
Oh, because I remember reading a Department of Labor statement and maybe something in the courts that said that employers could make the condition of employment. I thought, therefore, must have something unique, so I don't understand. Okay, thank you. If anybody can clarify, I'd appreciate it. I did hear the Department of Labor had said that they could make a condition of employment, but it may be against our bargaining unit. Thank you.
All right, we'll look into that, but as far as I know, we can't force anybody to take the vaccine, so. Lars, can you give us an update on the Wi-Fi and the phones and the communication system out there?
I really can't add anything more than what you said, Jimmy. That's the latest info I have from the IT department and general services. So what you said is the latest information.
Okay, and the phones that we got from Commissioner Burpo and the iPads, they're all working and they're all available to the residents?
Yeah, my understanding is the Wi-Fi issue, I don't believe was as significant as it was presented to you. I believe it was with individual residents' Wi-Fi on their personal cell phones. If they had a different network,
Right.
I think it was based on the network they had. So we have made the changes and I hope it improves.
Okay. Somebody has a question? Lita Amo, you have your hand still up, or is you're getting like me, you're muted?
I said I didn't take it down. I'm sorry.
Okay, no problem. Anybody else have anything else? I don't see anything, so thanks, Commissioner. And I'll add you to the list when I do send that email to the Family Council. They had some questions on staffing shortages. Deputy Commissioner Erickson answered that. In his opinion, he thinks this has to be addressed with the New York State Department of Health as the oversight authority. So you might want to stick around and hear the health department's presentation here. Okay.
There's currently no mandate for nursing home staffing, so I'm not, and I don't know how they're saying we're short when they're not in the building. They have no idea what our numbers are.
Right. Okay. Well, we're getting the information from somebody, so.
We have had, in the same vein, we've had a total of almost 120 employees, contractors, et cetera, that have either tested positive or have been out of work since November. Now, obviously, they're not all out at the same time. Currently we have about 15 people that are out. So yes, the COVID has impacted our staffing at certain times, but we are in a much better position now than we were, say, a month ago. Yeah, and you have to remember too, census is lower. So your staffing technically should be the same.
All right. Okay. Any other questions? No? All right, we'll move on to the Commissioner of Health. I see you there now, so the floor is yours for your monthly update.
Good evening, everyone. Thank you, Mr. Chairman. The Orange County Department of Health has been fully active in its response to COVID-19. We now are supporting two main missions. One is the COVID case investigations, the communicable disease case investigations, and that includes reviewing positive test results and preparing the information for contact tracing, which is under the New York State Department of Health efforts, developing and implementing quarantine and isolation orders, public health notifications when large-scale potential exposures have been identified and outbreaks as well as clusters. Vaccination implementation is the second track, where we're tracking vaccine distribution throughout the county, helping residents determine where they can get vaccinated, and implementing the department point of dispensing or point of distribution sites. The department's call center has seen a tremendous increase in volume of calls since the release of the vaccine, and continues to field calls from the public, from residents, mostly regarding frustration with the allocation of vaccine to the county, confusion whether or not they are eligible under that tier 1A and 1B, difficulty registering on the state link, and for senior citizens who are unable to navigate the web page because they don't have a computer. So we have partnered with the OFA so they can assist senior citizens that may not have access to a computer or may not be computer savvy. As far as vaccine points of dispensing, the department has started to move into the points of dispensing operations. This is something that as a department and a public health statewide, we have been preparing and training for decades. We've had point of dispensing drills and annually, and we are well equipped to handle that once we've actually received vaccine allocation. Our ability to dispense medical countermeasures to vaccinate large numbers of people in a short amount of time has proven and been tested for many years. On January 5th, the department received 800 doses of Moderna COVID-19 vaccine. And on January 6th, the next day, the department, along with the support of emergency services, our legal team, our MRC, and a number of other departments administered all doses to people who were eligible in the phase 1A category. Now that category is stratified by risk. The risk factors are determined by the CDC. And of course, don't only include the susceptible, vulnerable, and medically fragile populations, but also include the risk that an individual poses to others, hence the frontline workers and emergency workers that respond. So we were able to administer 800 vaccine doses. This point of dispensing was conducted in the Emergency Services Center parking lot using tents and heaters. On January 8th, the department placed an order for 3,000 doses of vaccine. We were allocated 200 doses and administered all 200 doses to those eligible under 1A and 1B. We are currently in the process of planning the next point of dispensing. Again, based on the allocation from the New York State Department of Health, unfortunately, the demand for vaccine far exceeds what the allocation looks like. And in terms of allocation, of course, the supply goes from the manufacturer to the federal government. The federal government allocates vaccine to the states. The state then allocates the vaccine to each regional hub. For our area, we're part of the Mid-Hudson Regional Hub that is headed by Westchester Medical Center, and they determine the vaccine reallocation per county for each provider entity within the county. Currently, within our county, we have 4 hospitals, 1 FQHC, 3 pharmacies, and our local health department that are tasked with vaccine administration. And are allocated doses from that hub reallocation from states. Once more vaccine is in place in the pipeline and released to our department, we are confident that we can support that daily throughput that is needed. But again, it is an issue of actually receiving the vaccine. Current COVID statistics in Orange County as of 1/18, we have had 28,848 cases. That is an increase of a little under 1,000 cases over the weekend. We're seeing approximately 300 to 400 new cases of COVID-19 per day. And the data is available both on the state tracker and is reported out daily. Of course, we are fielding quite a number of questions specifically with regard to vaccine, with regard to the variant and the mutations that individuals are hearing about, as well as the new types of vaccine that are being developed specifically from Johnson & Johnson and AstraZeneca, because we are receiving preliminary reports from their phase 3 clinical trials. Thank you.
Legislator Tortel.
Thank you, Chairman, and thank you, Dr. Gelman, for what you and your staff are doing through this entire pandemic. You guys really been incredible. Can you tell me, you had said that one day you ordered 3,000 and you were allocated 200. What is the status of the current ordering and also percentage of allocation that you seem to be getting out of the regional hub? And then you had also said you got 1,000 cases over the weekend. I missed the number of cases each day, new cases each day.
So we are seeing, on average, the actual number of cases that were confirmed over the weekend was 986 cases. We are seeing approximately 300 to 400 cases daily. So on average, it's around 350, 360 cases. New cases of COVID-19 daily. In terms of allocation, you're absolutely correct. We have requested 3,000 doses in doses last week. I believe this week the allocation promises to be around 1,000 doses, but until we have a vaccine in hand, it's very difficult to say whether all of those vaccines will be allocated as promised.
Thank you, Dr. Gelman. I really appreciate that. Are we being allocated less based on our density versus areas like New York City and Long Island? Are they basing it on that, or are they basing it on average population? How are they basing these allocations? Do you have any idea?
That's a very good question. We keep asking Department of Health in terms of their algorithm, because we are seeing certain areas receive more vaccination as would be reasonable per capita. They are saying that some other factors, quote unquote, play a role, such as population density, as well as the rate of complication, hospitalization, so on and so forth. It's very difficult to really gauge that, because based on our population, based on our actual population density, as well as rate of complication and the number of cases that we're seeing, the allocation should be higher than certain areas of the state. However, without having the actual algorithm and the formula in place, it's very difficult to gauge where we're supposed to be versus where we are right now. The state kind of is keeping that very well concealed in terms of what their formula actually looks like for allocation. And unfortunately, since the allocation is not directly to the health department, or at least through the health department, again, we kind of are dealing with these middlemen type of scenario where we have to go through the regional hub, which adds an extra layer to it.
Thank you, Mr. Chairman.
Leader Amo.
Thank you, Mr. Chairman. Dr. Gelman, again, thank you for the report. And the one thing I didn't hear, and maybe you could help me with it, it seems to me if our long-range goal is to get a substantial number of people immune, if you will, whether it's through getting the disease or a vaccine, I'm not going to argue which works, essentially getting what we call herd immunity, or at least something like that. Who in the state or the county is responsible for tracking Orange County's vaccination rate? So we as a county would know how we're progressing. We just heard that Commissioner Ledoux told us about the difficulty in getting some of the staff vaccinated. It would seem to me it should be important on our COVID website to talk about what our percentage of vaccinations are going forward, even on a rolling average. I understand that, however, but is anybody doing that? And if so, who?
That's a tremendous question. Thank you for that. It's actually a very good question. We have been trying to do our best to speak with our community partners and to have them report their vaccination rates to us. Unfortunately, the state has completely blocked that effort, and they keep promising weekly that there will be something similar to the COVID tracker up online, where the hub per se for us, Westchester Medical Center, will put up the hub with certain information pertaining to vaccination rates. However, it's not going to be as detailed as where we would need it to be to really be able to locally coordinate our effort. And as you've mentioned, to see where we are with our declination of vaccination rates, where we have to concentrate our efforts as far as education, outreach, and possibly standing up vaccination pods. Unfortunately, the state has been very explicit in ensuring that those providers are not reporting the vaccine allocation and the vaccination rates to the local health departments. And they kept promising weekly that they will put up that quote unquote COVID tracker like website. That has not happened to date. So I would imagine the answer to your question to be New York State Department of Health. However, they have not made that information available. And despite the numerous hub calls that we take part in, we have still not been given a clear answer. And again, it's not for a lack of trying on our part. We try to go through the NICHO, through other means to attempt to gather this local information, which we would typically have from our community partners, because again, historically, our community partners would report information like that to us in hopes of having that local coordination happen, but that has been vigorously and expressively blocked by states.
Yeah, I guess maybe you can drill down a little bit for me. I'm a little disturbed when you say vigorously blocked. Is that like an executive order? Or where's
What
it
I
coming
mean,
from? It seems like it's like we're not working on together here. I mean, and I'll ask another part, because in the beginning you talked, and maybe I didn't write it down. It seemed like there's very few locations in Orange County that have approval to give the vaccines. The hospitals, you said, and one federal qualified health center. So
yes.
How hard can it be for us as a county to go to them and say, can you tell us, absent of them being told they can't?
So they were explicitly told they can't, because when we were communicating with them, the state's position, and I do have the communications in writing, has been that they will be considered to be in violation of their MOU with the state if they disclose this information to the local health departments. And I do have this communication from NICHO, from our various community partners. And as you've heard, that there may be $1 million fine associated with any violation having to do with vaccination, so on and so forth. Obviously, that's a hefty sum. So yes, they were expressly told that they cannot report that data that we typically would gather to us. And it is counterintuitive, I agree.
Mr. Chairman, I know this might be a feel-good resolution, but I would ask to consider, maybe we should say something to the state on this fact, because this really is egregious. Because we're trying to make sure our county is ready to deal with this COVID, and we're trying to interact, and our businesses depend on it get going. Yet we have no yardstick to measure how well we're doing. And it certainly is not less than ironic to me to realize that, of course, the state would say that, because they're controlling the distribution. And why would they want to know what a bad job they're doing? They don't want anybody to know that. So I think I can understand the logic, if I heard Dr. Gelman correctly, or intuitively, inductively figure out your logic. I think maybe we should think about a resolution quickly. I don't have one period, but maybe we should talk about doing one for the floor that asks the state of New York to, at a minimum, tell us exactly how many people are vaccinated in Orange County and give us a proportion so we can measure it. As legislators, for one, I think we should be talking to our constituents. How come you're not? We'll notice that on your town, our town, we got the lowest rate in the county. Let's get out there and help that change. But we can't do it if the state's refusing. So I don't know what the committee feels about it, or you, Mr. Chairman. I think it'd be worth considering a resolution.
I agree with you. So why don't you work with the Commissioner of Health and draft something up? And if nobody has any objections, any other committees between now and February 4th is our full legislative meeting. Lee, when is your meeting?
Ways and Means is next Tuesday.
All right, so Chairman Brescia,
26th.
do we bring this to Ways and Means?
Yeah, I don't see why we can't.
All right, so.
You can do it on public safety if you want, Jimmy. You can do it on public safety.
When is yours, Kevin?
Thursday.
This Thursday?
Yeah, that might be easier. Yeah.
Yes.
Okay, so you get it done by tomorrow, Lita Amo, and
I'll talk to Dr. Gelman, and Chris, we can see if we can just get something at least written. If we have to modify it, if public safety wants to, modify it, at least we can give them something to work with.
Perfect.
Thank you, Mr. Chairman. Thank you, Dr. Gelman. I'll reach out to you or Chris.
Thank you.
All right. Legislator Sutherland.
Thank you, Chairman. Dr. Gelman, does the county or does your department have any intention on making schools go remote for 2 weeks after their week-long February break?
We have not received any information from the states just as yet, so we have not come out with those recommendations. It really will be dependent on what we're seeing.
Okay. What kind of recommendation would would the state tell you you had to do it, or is this a decision that you make?
Typically, the state would tell us, but for instance, just in the newspaper today, as I mentioned, the two variants, one the UK mutation, one being the South African mutation. So that would be the B117 and the 501YV2. According to the American Academy of Pediatrics, more American children contract COVID-19 from January 7th to 14th than any other week during the pandemic. So if we're seeing alarming rates across the board for children, and as you've seen, there are also new guidelines from the State Department of Health with regard to rate of community acquired transmission. As we're seeing an increase in the community, as I just reported, we're seeing 300 to 400 new cases a day. If those trends continue to increase, that may be a distinct possibility, because at the end of the day, it's really preventing transmission. That would be the key.
Okay, thank you.
Legislator Tui?
Thank you, Chairman. Commissioner Gelman, you mentioned before about we're anticipating another 1,000 doses. What date is that expected for the delivery of those? I'm not sure if you said that or not.
Typically, we receive deliveries on Tuesdays. Did we receive the delivery? We haven't received it yet, so that's why I kind of hesitate to say. Once we have vaccine in hand, I could say we have 1,000 doses, but until we have vaccine in hand, I just hesitate to say that we have it or will have it. We're waiting for it, and typically we have been receiving them Tuesdays.
Okay, and that was on an order of 3,000 again? You ordered 3,000, but they're saying you can get 1,000?
How many did we order? I believe we ordered 1,400, 1,800 this time.
I can't keep track of what was that.
We have to take a look, because don't forget, we have concurrent second dose pre-orders also that are guaranteed. So I'll just double check for you. I'll let you know.
Thank you. Thank you, Chairman.
All right, so you just confused me a little. You ordered 3,000 last week. You got 200.
Correct.
All right, so we were short 2,800. So that's just a back order, and then you ordered an additional 1,800 this week?
There's no order. Every week is a separate week of allocation. But second doses, because these are 2-dose vaccinations, for the 800 and 200 that we've actually administered for week 1 and 2, we now have to place pre-orders for those separately. That's why I just have to see how many we actually ordered this week, whether it was 1,800 or 1,400, not to mislead you. Because we only order first doses, and then we pre-order, we reserve second doses because they're guaranteed.
All right, so I'm still confused. So you're short 100 the first time. You ordered 3,000, you only got 200.
And right, and they're never giving those to us. So now second week we've ordered, I believe, 1,800, 1,400. And
you didn't say that we were never getting them, so that's
right.
why
We're never getting those.
All right, so now you lowered what we're asking for to 1,800.
In hopes of receiving slightly more.
I get it, but we didn't have that information that we're never getting at 3,000.
Yeah, we're never.
I didn't know whether it was in addition that each week you had to get another number and you had the back order in.
Right.
Legislator Tui, you have another question?
Yeah, so the more we dig on this, you get more, but it's so if we gave out 1,000 and you're ordering 1,400 or 1,800, you're saying that the order for the second dose is a separate order. So
right.
If you got 1,000 or 2,000 this week, they would be for the first time vaccination.
Correct.
And the ones, and then anything for a second dose would be a separate order that we're not discussing here because those are on an order by itself.
Correct. They're guaranteed. We have to reserve them, but correct. Yes.
Okay. Thank you, Chairman.
And these are separate from like CVS or these other distribution centers?
Yes, so 4 hospitals receive allocations separately. I believe it's actually 2 FQHCs that now went online as of yesterday. So it's 2 FQHCs and 3 pharmacies, but the pharmacies, 1 has them on hand and 2 haven't received deliveries just as yet. But yes, you're absolutely right. They're separate allocations from the hub.
All right, so the county exec just texted me. Every week I tell the state to give us the maximum amount they have available. And I tell them that based on our ability to get all of the vaccines delivered that they give us, then on the first day that we distribute it. All right. So the county exec's office is asking for the maximum amount we can possibly get, and the state isn't giving it to us. So, right. You have another one, Pete, or your hand is still up?
Sorry, Jimmy. I'm done.
No problem. Anybody else on the vaccinations? Legislator Tortel.
Thank you, Mr. Chairman. Dr. Gelman, one quick question I forgot to ask. If we have constituents who contact us and they're looking for the vaccine, and most of them I've been giving, the office liaison number because they've been senior citizens and they've had trouble with online registration. But I've had a few who've contacted me and they say, well, how do I register it to have it done in a hospital? I have a lot of health problems and allergies and so on and so forth. Is that something they can do? Because I didn't see it when I was trying to do registration for a couple of them online. How do we go about that? Is that through their doctor's office, or how do I direct them for that one?
They can contact their doctor's office. They're highly unlikely to have vaccine available at their doctor's office. The best possible way to go about it currently with this current structure would be to go on the New York State Department of Health Am I Eligible tool and put in the widest radius that you're willing to travel. Keep in mind there's no residency restrictions, so an individual in New York State can get vaccinated anywhere in New York State, and any site that is available that you're willing to travel to can be registered for. Please let them know, unless they have a date and time and address of appointment, they are actually not registered for that appointment until there's a confirmation. The backup to that Am I Eligible online link is a phone number for the state. It's 833-697-4829. That's the state's vaccination hotline. And then the backup number to that is 888-364-3065. That's the general New York State Department of Health vaccination number. As you mentioned, for senior citizens. Oh, I'm sorry.
Can you give me that?
Yes, so the vaccine hotline is 833-697-4829. And the general number for the state is 888-364-3065. Now, for senior citizens or anyone who cannot access the computer, the number for OFA is 845-615-3700.
Yep.
And what that would do is it would actually show which site has vaccine available, because with the way the state has been allocating vaccine, they're keeping very tight reins on which providers are receiving vaccine. And because they're bringing more providers on board, unfortunately, some hospitals or some of the providers may not have vaccine one week, but then they may have it the following week. So it's very important to keep checking that Am I Eligible tool, because that's the most up-to-date information on live links. And they may not have their site of choice, unfortunately, available at the time that they want it. So it's imperative to keep looking and to keep populating it.
Right, I understand that, but can they specifically request to have it administered at a hospital, or no, they can't?
Online, as long as that link is available and they call or they contact the hospital and the hospital shows us having availability of vaccine, yes, they can request it. But keep in mind, the state, again, is really rolling this out where certain providers, for instance, pharmacies are tasked with individuals 65 and older. Hospitals were initially tasked with emergency responders and medical workers, and local health departments with essential workers. So are really prescriptive, unfortunately, with the way they're rolling it out. So not only do you have to qualify under 1A and 1B, certain providers were tasked with predominantly vaccinating certain demographics. So just keep that in mind. They can absolutely contact them as long as the link is available, but just keep that in mind that some providers may not readily vaccinate even if they have vaccine available.
Okay, great. Thank you so much. I really appreciate it.
Thank you.
Any other questions on the vaccinations? Commissioner, I got a question on school sports. I know that Assemblyman Colin Smith is introducing legislation up in Albany on school sports participation. Where are we down here in Section 9? Because I ran into some people from Section 9, so.
So that guidance would come from the New York State Department of Health. They have not made any sports guidance available just as yet.
Okay, Deputy Commissioner Erickson, are you on?
I think we have to switch. You're back in.
Yeah, I'm back. Hold on.
I know that you used to go to their meetings.
Yeah,
Can you give them an update? Can you go to their next meeting and give them an update?
sure. I'll definitely try to do that. I was going to a
Alright.
bunch of their meetings. They're the same contact resources that I do, but I will do my best to make their meetings.
Okay, thanks. Update on the morgue?
Sure. So as you know, last time I spoke, we settled with a contractor for architectural and engineering on that. That contract is currently, it's with the name of the company is HHA. It is currently with them up in their office. They are signing that contract now. That was sent out to understanding like last week. So hopefully we'll have a signed contract back from them by the end of this week.
Okay. Anybody have any other questions for the Department of Health? Hearing none, motion to adjourn?
Adjourned.
Sutherland.
Okay, thank you. Everybody have a great evening. Thanks a lot.
You too.
Good night.
Thank you.
Yeah.
Thank you.